afternoon, ladies and gentlemen, and welcome back to the M42 main stage here at the inaugural Abu Dhabi Global Healthcare Week. We are halfway through day 3, and what an exciting day here at Adenec in the heart of Abu Dhabi, in the capital of the UAE. We kicked off today's proceedings with a very thought-provoking panel discussion. We've got many more of them to come, but for now, an inspirational talk. A lady who is part of the Longevity Forum family, and they are partnering with M42 this year for our program. We are very pleased to have with us, and I will just wait for the tannoy. It feels like we're at an airport and we're about to board a plane. But don't fly off just yet, because we've got a very inspirational talk. We're looking at building healthier communities through prevention, and an interesting case study. But to bring us up to speed, can I please introduce Professor Andrea Maier? She's the co-founder of NUS Academy for Healthy Longevity, National University of Singapore, and founder of the Chi Longevity, many other wonderful titles that she has, but I'm going to get her to come on stage and share them with me. So please welcome on stage Professor Andrea.
Thank you so much. Thank you. Thank you so much for staying. And do you hear me well?
Yes.
Yes? Okay.
Fantastic.
And really spending time with us, because time is the most, I would say, valuable we have.
Absolutely, and I don't want to eat into your valuable time, but just one quick question. You are a friend of the UAE. You have a relationship with the country.
Absolutely. I'm very, very proud to be here. I think the UAE is at the forefront of building a greater nation with preventative healthcare to really optimize health and to democratize health, which is very important. So hopefully my presentation, giving you an insight what Singapore is doing, we build even more greater relationships between countries worldwide.
Fabulous. So we can learn from this very interesting best practice, the case study of Singapore. Over to you, Professor Andrea. Give her a big round of applause and thank her for her patience with us this morning.
Thank you so much for being here. My name is Andrea Maier. I'm a clinician scientist. I really try to build an ecosystem to bring healthy longevity medicine into normal hospitals. I'm a hospital manager also by training. And at a certain point in my life, I thought, why do I, as a geriatrician, treat individuals with lots of chronic diseases, with lots of medications? Couldn't we do it differently? And there, my background of doing research in geroscience, which is the science to understand the aging process, since 25 years really helped shape a new, I would say, form of medicine. I will give you an example what we do in Singapore. I'm living since 3 years in Singapore, and I will give you insights of why Singapore has a certain approach, what the approach is, and how to relate that to the UAE. So thank you for having me. First, of course, disclosures. I'm working with a couple of multinationals to really shape the future also from a business perspective. I'm the founder of Chi Longevity, which is an evidence-based longevity medicine clinic, and I'm also the chief medical officer of NU, really dealing with data, how to build digital twins, how to predict who needs whatever treatment. I'm also working and advising the WHO, which I'm proud of. As you might know, we are living in the United Nations Decade for Healthy Aging. We are defining at the moment globally to see what to do in different countries. First, having a baseline of how countries are tracking, and then to intervene. And I also founded the Healthy Longevity Medicine Society, which is, I think, crucial to build a new arena of healthcare. For the ones who do not know or might not know what Singapore is, where it is, Singapore is a hub. It's a very tiny country. It's 40 by 20 kilometers with a population of roughly 5.5 million, with lots of ethnicities. Singaporeans are primarily Chinese origin, but also Malay, Indian, Caucasians, lots of other countries. And I think that's quite comparable, the multi-ethnicity to the UAE. We are a hub, not only for business, also for travel. Singapore is looking to really be a hub for medical tourism. And we are really the hub, I would say, in Asia. If we are looking at the life expectancy, and now I will touch on why Singapore is investing in healthy longevity medicine. Singapore is the longest living country, together with Japan and Switzerland at this moment in time, reaching a lifespan of roughly 84 years. If you're comparing that to the UAE, it's 78, 79 years of age. So Singapore is a very long living nation. If we are looking at the other side, at the fertility rate, there is, I would say, a problem, but also an opportunity to shape, I would say, the population even differently. The fertility rate of Singapore is at the moment 1.0. In 2002, it was 1.1, now it's 1.0, which means that there are not enough newborns to actually, in the end, care for the aging society. If you are comparing that to other countries, for example, here to the UAE, it's 1.5. What that means is that there is an accumulation of individuals who are aging, who are above the age of 65 years. And 15% of the population 2 years ago was 65 years and older in Singapore. In the UAE, it's 1.8. So what you see here, in terms of the fertility rate, we are trending to have less children. We are trending, and especially Singapore, to have a more aging society. What does it mean? There are definitions of being an aged and a super-aged population. Singapore developed from an aging population to an aged population within 17 years. In 2030, more than a quarter will be 65 years and older. And in 2026, in 2 years' time, Singapore will be a super-aged population. What does that mean? Very importantly, from a productivity perspective, this has huge consequences. If you're looking 20 years ago, we had roughly 1 older adult and we had 7 working adults. The relationship and the ratio really changed. In 2030, the ratio will be 1 to 2.3. And that has enormous consequences. How to deal with these consequences? So we have a lower fertility rate, we have an aging population, which means that we need workforce to care for all the individuals and to keep the nation as successful as it is. We also notice that it's not only that we have a low fertility rate, but also the lifespan. How long people live is very, very high in Singapore. So what is the secret? It has been proposed that Singapore is a blue zone. You might know the blue zones. We are called the 6th blue zone. We are the first blue zone in a city-state. You might know the Netflix series really focusing on what kind of lifestyle habits Singaporeans or others have that we can reach towards an age which is nearly exceptional, which is 84 at this moment in time. But it's not that we are living in Singapore in a blue zone and it's all natural, we are living in the woods and we are catching our fish. Absolutely not. There is a strategy behind it. And I think my aim would be that more countries have that strategy of building blue zones. So the Singapore government really has the strategy how to build an environment where lifestyle can be healthy for everyone, and we have dedicated facilities that we can live longer. And I will talk about that. We build an ecosystem. We build an ecosystem to understand not only why we age in terms of the biology of aging and how we could intervene not only in think about a fruit fly or a C. elegans, which is a little worm, but we also thought in Singapore, how can we translate the knowledge of why we age and how we age into human clinical trials. So that was established roughly 5 years ago. We have the Center for Healthy Longevity, where we bring fundamental knowledge of the biology of aging, which is the greatest risk factor for age-related diseases and in the end death, but also loss of productivity, into clinical human studies. We also now at a stage that last year, with the World Economic Forum with the delegation, we opened the first publicly available longevity clinic in a publicly funded hospital. So we are bringing the knowledge of why we age from animals into human trials and bringing that immediately into clinical practice. We also have public health strategies. I already mentioned that lifestyle is a very important factor, and I will give you a couple of examples. This only works if we understand the aging process well. And there are two elements being very important to bring that then into clinical practice and in the end into public health, because if we wouldn't bring it into public health, we would never democratize what we are doing. The first one is diagnostics, and the second one is aligned interventions. If I'm talking about the diagnostics, I'm talking about measuring the biological age. I'm not sure how many of you know your biological age, but I would hopefully advise you to get to know who you are, how biologically aged you are. You have your chronological age, and hopefully you know your biological age. So it's diagnostics. And then based on these diagnostics, where you are tracking in the aging process, we align that with interventions. So that's the reason why we have a clinical trial center. Very importantly, I think around the world, but also for the UAE, for Singapore, for many countries, is that we need educated staff, we need educated politicians, we need education about healthy longevity medicine, about healthy aging. That's the reason why we also founded an academy which now serves the nation, but also the global community, to bring healthy longevity medicine and the knowledge, not only in the public sectors, but also in the private sectors. This is all because we have one aim, and the aim is to increase the health span of, in this case, Singaporeans by 3 years in 10 years, which means everything we are doing, we have KPIs, and we are going to test if the interventions actually worked. What do we do in the public health sector? A very important thing is, if there is no public health sector being involved, we will not democratize, I would say, healthy longevity. That's the reason why now, a decade ago, the Singapore government started to build a healthier SG. SG is Singapore, a healthier SG is a government program. What we do, and it was implemented now 1.5 years ago, that every resident in Singapore has one family doctor. So there is a match, and that family doctor is the guardian of the health of that individual. We are giving the responsibility back to the individual with the guidance of a family doctor, while introducing education, what healthier living a lifestyle is. So lifestyle interventions are very important, and it's guided by the GP, but it's a responsibility of the participants, of the citizen, to actually to do it. There are lots of benefits because it's free. Most of the services are free of charge. The testing, the preventative testings, and the interventions. And I will give you a couple of examples. First of all, you need to know that Singaporeans eat in hawker centers. 80–90% of Singaporeans every day, lunch and dinner, they have down in where they are living, in hawker centers. We don't have really kitchens, and nobody cooks themselves, which is, I think, a great opportunity, because if hawkers feed the nation, they have health in their own health, in their own hands. That's the reason why the government is working with the hawker centers to actually dedicate lots of energy to knowledge increase, to say what is the healthier choice for food, what are the lower calories, what's the lower sugar, what is high in fiber. And now we have stickers for every meal to say, this could be your choice. Would you like to have that? And there's also incentives that it's cheaper. So really, while having that government approach, we are growing a healthier nation because of our eating habits. Another example is physical activity. We already can close the books that physical activity is good. My group, my research group, did lots of meta-analysis, umbrella reviews, how good physical activity is. More steps are associated with a lower mortality rate, lower incidence of diseases, lower frailty, everything you would like to have. Physical activity is good. We can close the books. How do you implement physical activity into a nation? In 2015, the government started the National Step Challenge. Individuals were asked, do you want a Fitbit? If you have the Fitbit, we will actually see how many steps you take. If you are taking 5,000 or 10,000 steps, you get incentives, so get vouchers. So it's incentivized by wearing devices, while increasing, for example, the income or by getting vouchers, for example, to have healthier meals or to buy other groceries. In 2015, it was implemented. At that moment in time, 1 million of the population, which is roughly 20% of the population, took the Fitbit. And they analyzed in 2018 the first results of the STEP challenge. So it's about setting your own goal with regards to the steps, getting there, and getting financial incentives. Nearly 700,000 participants were analyzed in this research paper, and the baseline steps were 7,500. And they increased while getting the Fitbit by more than 1,500 steps. And even having less incentives, less vouchers, and Singaporeans love vouchers, the increase was nearly 1,000 steps. We are now entering season 5 in terms of the STEP challenge. More than 2 million of the Singapore population are now wearing these kind of devices. And there is a huge benefit that more of the population every year, and last year it was 7% more, are reaching the WHO guidelines of mid to vigorous physical activity. So having these incentives works. Having already a smartwatch and a Fitbit, whatever you want, helps to get you active and get a nation active. It's not only that we need food and we need physical activity, we also need our environment. And I'm very proud to live in Singapore because it's a green city. We really bring in the environmental aspects of healthier living. It's just one example, the Singapore Health District, which is a hub where we do research, really showcasing that the environment should be built to enable physical activity, even in a surrounding where heat and humidity is there, like in the UAE. And we are doing lots of research in this health district. And we are doing research not only with academic partners, but also with the university hospitals, and most importantly, with the Housing and Development Board. Because how can you create an environment without having ministries talking to each other? So the Ministry of Housing with the Ministry of Education, with the Ministry of Health. And that will really build a baseline for purposeful longevity and healthy longevity in the end, in my view. And you can really see it as a living lab. These are lifestyle interventions. Can we do more? Can we even individualize it? Can we optimize the health of individuals for you and me in the end? There were lots of debates in the last 3 years if we should bring healthy longevity medicine in terms of a clinic into the public health space. There were lots of parliament members debating it, and the result was that there was an agreement to have much, much more understanding of the fundamental aging process, to antagonize it, to really be on the forefront, and to translate whatever we know from animals into humans. So that's great. That was a stepping stone to really build an environment. And the environment was really nurtured by societies as the Health and Longevity Medicine Society. If you don't know yet about this society, this is the time where you actually scan this QR code. This society is the first bringing healthcare professionals together to build the new ecosystem of health and longevity medicine, which is defined to optimize health by antagonizing aging processes across the lifespan. And that's what we want. Health and longevity medicine has 2, as I already said, very important pillars. And that's diagnostics and that's interventions. Get to know you and intervene and remeasure yourself. So we are really working on the fundamental basis, understanding the biology, while measuring biological phenotypes. Think about your genome, an epigenome, a microbiome. Think about the heart age, the lung age, the brain age. And we're also working with digital phenotypic characteristics, like working with smartwatches. And we have the interventions which are already in place and can be implemented into clinical practice. It's very important that Singapore thrives to be most evidence-based, that we can translate it into clinical practice for the entire nation in Singapore and around the world. I'm just reminding you that basing any interventions on animal models is not good enough for any clinical implementation, and we really want to push in a worldwide network, hopefully together with the UAE, the randomized controlled trials, which were leading to guidelines. That all led these investigations to the opening of the first publicly funded health and longevity medicine clinic. What we are aiming is to reduce the biological age of individuals with novel interventions. So it's a research clinic, but implemented into normal practice care. Every patient we are seeing is implemented into the research program. What we really strive to do is to see if not only it's effective clinically, that people are biologically younger, but very importantly for a country, that's also cost effective. And that consumers like it. We opened our website for 48 hours while opening the longevity clinics, and we had thousands of individuals who wanted to come. So if you are trying to implement it, be aware that lots of customers are knocking on your door. But we also have to upskill our healthcare professionals because there is no training yet. And there the Health and Longevity Medicine Society really kicks in. We built a framework internationally now, together with Maier, the Mayo Clinic, but also with Sheba Health, to really build frameworks and guidelines how somebody could open longevity clinics in publicly funded hospitals. So again, there are diagnostics, there are interventions, measurable outcomes which are reliable, which is important, and together with a multidisciplinary team which has to be created. So if you want to learn more, we just published this paper in Neuroscience, really understanding and also looking at the barriers, why it's possible and not possible to implement whatever care into the current healthcare system. Nothing will really function without talent and without education. So just as an example, I think as an example which can be replicated across the globe, is the Academy for Healthy Longevity. We are recruiting talent at this moment in time from across the globe to teach in Singapore and then to spread again out in the world, to really create an ecosystem where people find each other, which are like-minded, to learn from each other, to build and to create a different healthcare system. So we have talent incubators, we have intensive courses, we will have an MD course very soon, which gives accredited knowledge transfer into healthcare services, and we are serving the global network. So please reach out if you want to learn more. Summarizing my talk, I think there is not a challenge, I think there is an opportunity. There's an opportunity to learn how we can really optimize health with decreasing fertility rates, with increasing lifespans, hopefully with increasing health spans, with dedicated researchers bringing trials from animal models into humans, to clinical care, to really showcase what are effective, cost-effective, and clinically effective models to really shape than we have at this moment in time with respect to health. Thank you so much.
Professor Andrea, thank you so much for your time. I know that we are time precious this morning because we have changed the schedule. But any burning questions, because Professor Andrea has come all this way? I'll take two very quick questions. If anybody, don't be shy at this point. Oh, wow. No bidders? Brilliant. Love it. Dr. Andrew, you always have fantastic questions. Fire away. Very quick one.
Thank you. That's a really good talk. And on population, it's great. But I've found as a doctor that just diet and exercise is often not enough.
Yep.
You need medication to help them. Can you expand? Are you actually using sort of medication for people who are struggling with just diet and exercise to change their longevity and their epigenetic clocks?
Yes, absolutely. So we are heavily focused to see what molecules are influencing the biology of aging, and molecules can be just supplements, but can also be repurposed drugs or new drugs. So it's all in the making. I would say that we are, from an evidence level, we already have evidence for some of the molecules which we are giving for supplements. You know that the TAME trial, for example, testing metformin, is nearly up and running. There are already 15 studies, randomized controlled trials, giving rapamycin or Rapalox drugs. So I think we are learning at this moment in time how to utilize, repurpose drugs to give to healthy individuals. I think there is a struggle at this moment in time in terms of appropriate outcome parameters, which inhibits, I would say, the conversations with with the FDA or with the EMA. But there is absolutely, we can enlarge the health span, I would say, by 8 to 10 years with very good lifestyle interventions, but that might be the limit. I think personalizing the lifestyle interventions are very important. Know what you do, and then add on, for example, GLP-1 receptor antagonists. So many other drugs, which are now in the test phase for healthy individuals to keep them healthy, to optimize them.
Fantastic. Thank you so much for that question and for that interaction. Professor Andrea, may we get a photograph with you before you leave our wonderful stage here, and we're going to continue with another panel discussion. So audience, please stay with us as we reset the stage. I'll ask the photographer to take the photograph. Another round of applause for Professor Andrea. Thank you so much. We're back in just 2 moments. Thank you.